Stop discussing other people. Stop talking about problems. Go decide what problem you want to solve, however small or big it is, and starting today, go and solve it.
Whatever the mind can conceive and believe, the mind can achieve.
Welcome to the Dream Big and Think Different podcast, where we inspire, impact, and empower.
Progress is impossible if you always do things the way you have always done things.
It's time to dream big. Here's your host, Dr. Sachin Maskey.
Hello, everyone. Welcome to another episode of Dream Big and Think Different podcast, where our mission is to inspire, impact, and empower millions of people. I'm your host, Dr. Sachin Maskey, and today we have a very, very special guest, another dreamer, Momo, who is all the way from right now, currently. Where are you from, Momo, actually?
I'm in Seattle.
Seattle. Okay. So he has a very inspiring story, and he's trying to make a massive disruption in the healthcare industry and around the world. We all need to, hear and learn. I'm very honored and privileged to have you on the podcast. Welcome to the podcast, Momo. How are you today?
Thank you. I am having another fantastic day.
Great. Good to hear that. So a little bit about formal bio about Momo, who is he, and we can start with our podcast. So today's topic, I would like to listener, there's no, we don't have any financial or any kind of, a connection here. This is, basically educational only, and I don't have an affiliation with Viome, but I found it very interesting what Viome is doing for past 7 years. The topic for today would be illness is optional, which is the future of medicine. And we're going to talk more about it, but a little bit of formal bio again. Dr. Vuyisich, or Momo, is an entrepreneur, scientist, and the co-founder, chief science officer, and head of clinical research at Biome Life Sciences. His passion is to use science and technology to improve human health with focus on disease prevention using data-driven personalized nutrition. He is also an adjunct professor at the University of New Mexico and New Mexico Tech. Before co-founding Viome in 2016, Momo spent 12 years at Los Alamos National Laboratory, where he led an applied genomics team, which developed the core technology used by Viome today. Dr. Vuyisich also has an undergraduate degree in microbiology and PhD in biochemistry. He has published more than 40 peer-reviewed scientific papers. With that being said, my first question to you is, who is Momo and why he's in this world?
Yeah, so I think that actually for the audience who is interested in anything financial, actually, this is a good opportunity because I think the world is going to change very dramatically in terms of healthcare in the next 10 years. And
Absolutely.
so with that, we'll follow different financial markets. Also, my company is now raising Series D. So if anyone wants to invest in our company, we're still privately held, but once we go public, things should go, big time. So I think anytime you're disrupting a big, societal system like healthcare, I think that there's going to be big financial impact. So this is, I think, very educational for people to understand how the world's going to look 10 years from now. So
Absolutely.
so my mission every single day for the last 14 years has been to build a healthier world. And let's talk about what that healthier world looks like.
Mm-hmm.
So as a metaphor, we've already done this for airplanes, and nature has already done this for humans. So the world that I want to build is where you're 95 years old and you're essentially completely healthy. You're cognitively healthy, you're mentally healthy, you're physically healthy at 95, right?
Yep.
And then maybe at 96, you get pneumonia and you die. And that's it. Now, that sounds potentially, when I say it, like science fiction, but this actually happens every single day in the world. There are now hundreds of thousands of people who live to be in their 90s, who are very healthy. They just get some kind of an acute illness and they die. But they had a very long health span. And So nature has already figured this out. We don't, this is
Mhm.
not science fiction in terms of like we're trying to build a wormhole or a spaceship or something that doesn't exist. All we're trying
Yeah.
to understand how nature works, bring heavy, heavy science to it with biochemistry and mathematics, and enable people, give it to people via an app to enable people to make every single decision in their life, so nutritional decision and lifestyle decision, in order to achieve this kind of a lifestyle. There's no mystery, there's no magic, there's no luck. It's just science. So that's one side. And the other side, how do we do that? Well, think about the systems that have been implemented for airplanes. So the example I like to give is the Boeing, not the Boeing, but the Airbus A380.
Mhm.
Airbus A380 is the largest passenger airplane ever made, most complex machine ever made to fly. It
Mhm.
carries 400 people, 700 miles an hour, across continents. It has never crashed ever, not once, right?
Wow.
And it's got like 500,000 miles of wiring. It's got enormous thousands of systems for running the engines, for environmental systems, for hydraulic systems of control, it's an incredibly complex machine and it's never
Mhm.
crashed. And why is that? It's because of the system's approach to the health of this machine, because the consequence of this machine getting sick is 400 people dying. And so there's been a lot of engineering put into how do we keep this machine healthy? And the way we do that is we understand every part and what role it plays. We understand how to measure it and we understand when it's going to fail. And
Mhm.
so that airplane, what you don't see as a passenger, that airplane goes into regular maintenance, meaning it goes into a hangar and there's an
Mhm.
army of people that go and measure parts. And when a part is about to fail, before it fails, it gets replaced. And
Mhm.
so all you have to do, which is not, it's a sort of a sarcastic comment, all you have to do is go and inspect, 100,000 parts on this airplane every year, right? But then you can see the wear and tear on every part and you can replace it before it breaks. And so why
Mhm.
can't we have the same system in humans where, if a pilot has a million gauges in the cockpit, he sees or she sees a gauge that's going from green to yellow,
Mhm.
an alarm goes off and tells them, hey, you need to do this. The pilot follows a checklist, does it, and boom, the gauge goes back into green. Why can't I have gauges for my health? Why can't
Mhm.
I be told exactly what to do to move a gauge from orange and red back into green? Well, that's exactly what we've built. That's exactly what our app does. So our app currently includes 68 such gauges for 68 different parts of the human health, and then it tells you exactly what foods to eat and what foods to avoid in order to move that gauge into green. And so we've
Absolutely.
we've implemented basically the same principle. So that's a part of the mission. You asked me what my mission is, and my mission is to have an app we call our assistant Vi. So just like Alexa is for Amazon, we have a Vi, VIE. So
It's
that's
in.
our assistant.
It's an app.
AI assistant. Yeah, so it's a part of our app, right? So our app has delivers results and recommendations and has a chatbot, and the chatbot can be used for coaching. We are currently developing that, so that's not yet available to
Okay.
customers, but soon it will. We're beta testing,
Okay.
um, and so, but long term, let's say 5 to 10 years from now, there's going to be prototypes and early versions much sooner than that. But let's say 5 to 10 years from now, it'll be a very mature system like iPhone 15 is very mature right now, right? So five
Mhm.
to 10 years from now, what you're going to be doing is you're going to be basically making every single dietary and lifestyle decision that is
Mhm.
based on your biology, not some average human biology, not on some study in a different population, not something done in mice, but it'll be strictly based on your biology. And
Right.
AI will be telling you exactly what to do. And the five things that AI will be telling you what to do is your diet. So, what foods should you eat in what amounts? Your supplements. What supplements should you be taking and which ones should you not be taking? It'll be telling you everything about exercise. What type of exercise should you do? How frequently? What time of day? How intensely? All of that. And sleep. It'll tell you when to sleep, how long to sleep, and so on. And last but not least, fasting. Would you benefit from fasting? And if you would, what type of fasting? How frequently? How long? So these are
Hmm.
the five sort of very important things that we are building. Now,
Amazing.
what's missing here? What's missing here from what I call pillars of health is mental health, cognitive behavioral component. So some kind of a behavioral coaching. And there are many companies out there that have been working hard on this. Like Headspace is one of them, one of several. Um, but our health very much depends on our environment, our community, our family, our friends, and our mental health state. And while mental health is seriously determined by nutrition and gut microbiome, it's also determined by our environment and our community. And so those are all things that are going to be integrated and enable you basically to fine tune absolutely every aspect of life to where you can live the life that I live today, which is I wake up hyper excited every day and I'm super grateful for every minute of every day. And I feel that I'm productive 7 days a week. I intertwine my work and my family and my fun to where I always work and I always have fun and I'm always with my family, helping my family and friends. So it's just one continuous life without having to separate, oh crap, I have to go to work now, it sucks. And then I have to come back and now I have to pay attention to my family. And now this weekend, are we going to go on a trip or not? And separate that. No, you can actually make a system where all of this just completely blends. It's seamless, it's fun, enjoyable, and you look forward to every day, whether it's a Monday or a Saturday. It doesn't make any difference. Every day is hyper exciting. And I really
Absolutely.
want to bring that to everyone with hardcore science, not telling people, why can't you just be happy, right? Some people are depressed. Some people are anxious. Some people are stressed out. Some people have all kinds of chronic problems. I was one of those. And when people tell them eat healthy, what does that mean? No one knows what that means. That's just a ridiculous statement to make today, unless you're following Viome, of course, is eat healthy. Because if you say, okay, I want to eat healthy, so okay, let me start with dairy. Is it good for me or not? You can find papers that say dairy causes cancer. You can find papers that say dairy is super good for you. You go to red meat, you go to coffee, you go to any foods, and you can find scary papers that say it causes cancer, causes chronic diseases, or it's fully nutritious and good for you. So, what can you eat today? You can't eat anything without being scared. And so we really, and that was
Hmm.
my journey a long time ago when I had an autoimmune disease. And so we really have to bring science and individuality because I'll just finish this mission with the statement that nutritional sciences have had a fatal flaw forever, and that is to make an assumption that a food is either good for all humans or bad for all humans. That is a absolutely fatal flaw because that is wrong. And so if you ask the wrong question, is coffee good for all humans or bad for all humans? You're going to make a wrong conclusion. And that's why the story flips. You should be asking all along, who is coffee good for? Is coffee good for you or bad for you? And only you, based on your biology. And that's the paradigm shift that we've made at Viome.
Thank you. Thank you for sharing your beautiful mission, and you're doing amazing. And I'm really fortunate and honored to take this interview today. And I've been also in the medical field for more than 20 years. And for the past 4 years, I have realized that, you know, the medicine we practice currently, as you have mentioned, unfortunately, we are not providing health to our patient. Basically, I still practice 3 days a week. I do other things, as I mentioned initially, but I have more than 4,000 patients, which I've been treating there for more than a decade. Three-generation family, and the some of the things you mentioned today about pillars of health, which is food, exercise, stress management, which is kind of mental health, and sleep, which is also a huge part of it. I totally agree, and I'm really excited today to learn more about Viome, and we're going to talk more about it. Personally, I want to know more about you, and that's your journey. And the next question, I think this is a Dream Big and Think Different podcast, and I like your energy, and I think your mission is very impactful, and hopefully, this is going to be impact a million, not in millions of billions of lives in this
Billions,
world.
exactly.
So let's start with your since it's a dream big and think difference. I want to know your childhood dreams when you're. Let's go back to your younger age, however you can remember. And
Yeah.
what was your dream when you were a child?
It's a complex story. I grew up in communist Yugoslavia, so my childhood dream was to get out of there. So very different
Yes,
from what I'm doing today. And then once I got out of there and I moved to the United States with no family, no friends, no money, the dream was, how do I make it in this country where I can't speak the language? I don't know
absolutely.
anyone. I don't know how anything works. I grew up with news saying that capitalism was evil and that capitalists are out there to get you, and all
Yeah,
that. So I had to overcome a lot. So that took a phase of my life to just, like, when other graduate students were buying homes, I was keeping an Excel spreadsheet of every purchase I made down to the penny to make sure that I can pay that off at the end of the month. So
absolutely.
typical first immigrant, lifestyle. So it was sort of like the next 10 years going through college and PhD and postdocs. It was literally just survival. Do I have enough?
So Momo, when was this? Like back in 1998, or when you
From
come to the
mid
United
90s
States?
to mid 90s to mid 2000s. Yeah.
Oh, okay.
So
Wow.
that was that phase of my life where my dream was simply to survive and make it in this country. So that was that phase, and then I got a job as a scientist at the National Lab in Los Alamos. The famous Los Alamos National Lab. Bought
Hmm.
a house. Wife had a good job. Our kid was up on the way, and so that's when you can actually you would think that you would start to start dreaming. But you see, I was sick. I had an autoimmune disease at that time that was basically
Wow.
dissolving my body. And
Hmm.
so now I use the statement that when you're sick, you only have one dream. Healthy people can dream about many things, but when you're sick,
Yes.
you only have one dream. And so
Yeah.
waking up every morning with squeaky joints, with painful arms, with painful everything, having to
Hmm.
go hit the shower before you lift anything. I mean, it's a long story. Autoimmune disease is horrible. Every
Yep.
minute of every day is horrible, and your
Yeah.
mind and your body are consumed by this. And
Hmm.
so, um, to me, that was basically my dream, to get rid of this thing, because the doctors told me, even with the anti-inflammatory medications like biologics, I will be in a wheelchair by the time I was 45. And to me, as a
Hmm.
super energetic person who does all kinds of sports, goes backpacking, goes camping, I hike a lot, that
Hmm.
was simply, and travels a lot. That was devastating, right? That I would be in a wheelchair
Yeah.
by the time I was 45.
Wow.
So consumed myself with finding the solution, and I knew there would be a solution because I was convinced that this was not genetic.
Right.
And finally, I was able to find a solution. It was basically a dietary component was triggering my immune system. I removed all mammalian food products from my diet. I started curing myself. In about a year, my body completely healed, and I haven't had any symptoms since then. So I was able to get rid of that. And now, when you're healthy, you can start dreaming. So really, my life that I live today
Hmm.
starts at that moment when I cured myself of this autoimmune disease. Everything before that was sort of survival mode. In communism, it was to survive communism because I was, malnourished and undernourished all my childhood. And then when I moved to the United States, it was to make it, just to have a
Hmm.
life. And
Hmm.
then the next phase was getting rid of the stupid autoimmune disease. So all of
Hmm.
that was just one focused point. And now, uh, after that, the focus point has been what I already described as my mission, which is to make the world a healthier place and enable people who don't understand science, to actually empower them to understand their body and make the right choices for their biology. So the
Hmm.
story about me is then basically, to me, the most exciting is this part here in the last 14 years. So in 2010, I decided to completely change my scientific career and focus on the platform that we are using today at Viome. So spent 6 years
Hmm.
developing the technology that powers Viome today, because in 2010 there was no technology to profile the human body. We go back to that airliner, Airbus A380, and
Hmm.
so you have to measure it, that A380, at 100,000 points. And in
Yeah.
2010, and even today, if you go to a doctor and you say something's wrong with me, they're going to do some lab tests that produce maybe 30, maybe 40 data points. But
Hmm.
the human body is vastly more complex than measuring 30 data points. There are so many sick people where you send them for the labs and the labs come back perfect and you say, you're healthy. But of course, they're not healthy. They're there because they're not healthy. They're suffering. And the 30 points that you're measuring have nothing to do with their disease. And so
Hmm.
you need to have, hundreds of thousands of data points about the human body. And today we're about 22,000, a bit over 22,000 data points that we measure with our technology. But eventually we'll get to hundreds of thousands as we reveal more secrets of the human body. So 6 years I spent as a scientist at Los Alamos National Laboratory developing the technology that can digitize the human body, measuring
Hmm.
relevant molecules, and it's not DNA. So we don't do DNA like everyone else because DNA has failed on its promise.
Yeah.
And then in 2016, Naveen came to Los Alamos National Lab. We did a little bit of a Shark Tank. I won. Naveen invested and started the company with me. And now, almost 8 years later, we have more than 500,000 customers in more than 100 countries, and we're on our way to become profitable and scale. And we have some clinical trial results, and we have a very mature machine learning AI platform. We have a state of the art clinical laboratory in the United States, and so onwards and upwards now.
Yeah, that's amazing. So yeah, I really think the story behind how you started and the team, and actually Naveen, I want to mention that he's a billionaire, and how I found him was one of his Moon Express company was he's trying to bring people to moon in less than $10,000, which is amazing. But so I guess the Viome mission is very noble, and I am like to know a little bit more about it. But before we go there, I wanted to know about you again, Momo, and trying to figure out more about you again. The question is, who and what inspires you and drives you every day to be productive?
I mean, I don't need such a person. I mean, I've been self-motivated and productive all my life. So, I've held full-time jobs or more than full-time jobs since I was like 17.
Oh, wow.
So I'm just a hyper energetic kind of guy. I don't need, I wake up and I'm ready to go.
Okay.
So I don't, that's some kind of an innate thing where I realize very, very acutely that we are here on earth for a short period of time, and I don't
Mm-hmm.
want to waste my time. I basically, when I'm 80 years old, I want to be super happy with what I've accomplished, and I mean, I'm already there, kind of. I'm really happy with my life, but so I don't need any inspiration. But there's one person who I think is absolutely by far my biggest hero, and that is Elon Musk. I mean, he's
Mm-hmm.
obviously very controversial, and I don't follow him, and I don't watch the media and how they interpret what he said or what he says and all that stuff. That to me is just mundane, useless waste of time.
Yep.
If you think about what this guy has done for humanity, and if you think about how he's done it, he comes from another country. He came to the United States with nothing,
And
and
when he was 26.
yeah, and
It's
so
crazy.
for someone to achieve this level of success and impact, this is the
It's
example
mind
that
blowing.
that I like to give. So I lived in Los Alamos, New Mexico, for 15 years.
Oh, okay.
The county council there named the city the Science City. Okay,
Okay.
this is one of the wealthiest counties in the United States. It
Mm-hmm.
is one of the most highly educated counties in the United States. Like every neighbor has a PhD in physics. It's you go to a bar and they talk about particle physics and quantum physics. They don't talk about the weather and things like that. I mean, it's an extraordinary place in terms of science, knowledge, education. Right? The
Right.
city council and the county has lots of money, lots and lots of money, support from
Mm-hmm.
DOE and all that stuff. And
Mm-hmm.
for 20 years, they were talking about bringing fiber optic fast speed and or giving basically internet for free in the county for 20 years. Every
Wow.
year they talk about it. They talk about it. They have meetings and they bring external people and advisors and they plan
Mm-hmm.
it and all that stuff, right?
Yep.
Then you go to the United Nations, and they've been talking for 20 years about bringing Wi-Fi and internet to poor countries. How the most
Mm-hmm.
important thing for young kids in developing countries is to have access to the internet so they can have all this knowledge. And they meet and they talk and they have expensive meetings and galas and all this stuff. And yet those kids still do not have internet, right? After 20 years.
Right.
Elon Musk says, watch me. I'm going to just launch freaking 8,000 satellites into Earth orbit and bring internet to everyone in the world, right?
Yeah,
A
yeah,
single guy
yeah.
does what all governments in the world, all wealthiest counties, all smart people, all politicians have been talking about for 20 years. And to me, that
Yep.
is the biggest differentiator in life between success and not
Mm-hmm.
success. Are
Yep.
you talking about things or are you doing
Doing.
things?
Absolutely.
That's it. It's that simple. So if you're sitting with someone talking about complaining about things or speculating about the future or
Mm-hmm.
talking small talk about how someone said something and what the media articles talked about and
Mm-hmm.
how, oh, this guy's this and this guy, all of that, you're wasting your life away. Stop
Yeah.
doing that. Stop
Mm-hmm.
talking about people. Stop talking about problems. Go and say to yourself, starting today, I'm going to solve this problem. Whether it's
Mm-hmm.
education, whether it's healthcare, whether it's peace and war, whether it's whatever it is that you're passionate about. Today is the day that you say, I'm going to go work on it. I'm going to actually do it. And I'm going to
Yep.
stop this BS about, oh, Elon Musk said something today. I hate this guy. I'm never going to buy a Tesla. What kind of attitude is that, right? that is
Absolutely.
that is what makes this world a worse place, when people have that
Mm-hmm.
kind of attitude. Go and do something that's
Yep.
needed.
You're listening to the Dream Big and Think Different podcast with Dr. Sachin Maskey. Be sure to stop by SachinMaskeyMT.com to download a free copy of Dr. Maskey's book.
So what I wanted to also learn about you before going to Viome quickly is about, you have been working this 14 years, you said 2010. So what are some of the struggles and challenges you had personally, like setting up this company? If you can share with us, that'd be great.
I mean, I can literally spend a week talking about that, right? that's a
Yeah.
that's a massive topic, but I'll just pull out some takeaways. So first of all, I spent 6 years developing the technology, right? So in 2010, I realized that there was no technology. So DNA sequencing is not going to make people healthy, because
Mm-hmm.
when you have when you're healthy, you have the same DNA. When you get sick, you have the same DNA. So that DNA can make you sick or can keep you healthy. So how
Yeah.
can the DNA tell you then how to keep healthy? It can't.
Right.
It has the potential to keep you healthy and to make you sick. So it's just a potential. So DNA basically is not good, but everyone was focused on DNA. And still, 14 years later, still everyone is doing DNA because it's easy, it's cheap, and people are brainwashed to think that it's the most important thing in life, which it isn't. It is an important thing, but it has minor importance in our health. Um, so then I also realized in 2010 that microbiome is a part of our body. It's not a foreign
Mm-hmm.
object that we tolerate or that it's bad for us, EU germs. I realized that evolutionarily, we have actually evolved as humans to depend and to work together with the microbiome to maintain our health. That is
Mm-hmm.
why the blue zones, which are these areas of super healthy humans, they are all in rural areas. They're not in cities where everything is clean, where people go to the doctors and take antibiotics, where they consume foods
Mm-hmm.
that are ridden with pesticides and ridden with preservatives. All blue zones are rural areas where people live off the land. They live
Mm-hmm.
in nature. They're one with nature. They don't sterilize anything. They don't live a sterile, isolated life. They don't have pollution. They don't have antibiotics, all that stuff. And so that's a
Mm-hmm.
that's a very important thing to realize, that gut microbiome nurtures us and we require it. And there are many examples of that we don't have time to get into.
Right.
And so now when you realize all this, and basically I said, you know what, I need help with this. This is such a massive problem. I need help with this. I basically held a series of meetings with my fellow scientists and said, I want to create this platform that does this. Every single one of the scientists said, this is crazy. Like, this is science fiction. This will never work. This is like, we respect you so much, but this is just crazy. We're not
So a
interested.
lot of natures you had.
I mean, not a lot, all of them, right? And so I said, well, if you guys don't want to help, I'm still going to do it. And so
Wow.
completely giving up all my previous scientific projects and
Uh-huh.
starting basically a new career for a scientist, everyone around me, including my closest friends, said, this is a scientific suicide. You
Mm.
basically, in a year, your scientific career will be over. You will become a manager and you're done. That's what's going to happen. Right.
Hmm.
And I said, watch me. I said, it's worth trying because I don't want to just continue doing what I'm doing. And so I completely gave up all my projects, all the money that I had for projects, everything. And I started new. I had one person who supported me, which was great, super great.
Hmm.
And then basically restarted my career. And so that was one challenge. The next challenge was I'm trying to develop a technology that doesn't exist, that everyone believes cannot be built. And
Hmm.
you need to get grant money, research money in order to develop that technology. So I had
Hmm.
to really find ways to explain what is it that I'm doing, why it's going to work, why am I the person who's going to solve it. So that's another challenge.
So the
Another challenge.
capital,
I'm sorry.
you said capital was a challenge.
Yeah,
Getting,
absolutely. I mean, as a
yeah.
scientist, you have to get grants, and that's a very competitive process these days. It's extremely difficult to get grants, and I was able to get close to $50 million in grants in 6 years. A typical scientist would get, you know, a couple of $100,000 per year, and I got 50 million in 6 years. And then the
That's
next
amazing.
challenge was scientists are supposed to publish papers. They're not supposed to spend 6 years developing a technology. That
Yeah.
there is no framework in science that allows you to work for 6 years to develop a technology without publishing tons of papers. And so that's a huge challenge that if I was distracted by writing papers, I wouldn't be able to develop this technology. So I had to basically convince my funding agencies, be patient with me, and we're making progress, right? Every single day was a challenge in that I had to make a choice. Are we going to just solve a problem so we can publish a paper, but that solving that problem in that way in order to publish a paper doesn't actually solve the problem? Or I have to make a sacrifice and say, no, we're not going to solve that problem to publish a paper. We're going to solve the problem that we need to solve. So let's keep moving. Let's keep moving. So for 6 years, I had to intentionally do it that way and train all my staff of 35 scientists to think that way, that we're not going to focus on publishing papers. We're going to focus on solving the problem. And after 6 years, basically, when we had that Shark Tank with Naveen, where other scientists talked about these imaginary things, I have this instrument that measures these things, and maybe in 5 years, we could measure something useful. I pitched that we have already developed the technology. It already works. I have the product lineup already set up. We're going to have revenue in 6 months. This is how it's going to work. Everything is ready to go, right? And in fact, we had revenue 5 months from starting the company. And
Wow.
so it was very mature. I had already planned it all out, but that was a huge challenge to do it in an academic environment. Then once we started the company, as you know, 95% of startups fail in the first few years, right?
Hmm.
But we had a system that is basically bulletproof. And that is that we have Naveen with money, with the network of financiers. So we've raised $175 million. We have Naveen who has started up companies and run them successfully to multi-billion dollar valuations. So that's the
Hmm.
business side of it. These are the three pillars of Viome. The second is me, who brought all the science and technology on the what we call the wet lab side and clinical research. So how do you profile the human body? How do you do analytics? How do you measure these things? How do you produce high quality biochemical data? And then the third pillar, which was extremely important, is our chief technology officer, Guru Banavar. And Guru was basically the leader in AI in the world. He worked for IBM for 20 years. He developed IBM Watson. He led the Jeopardy project at IBM. And so we were able to recruit him very early on in the company. And now he's been with us. Basically, he basically, us three are the pillars of the company. So that's one part, that you have full coverage of business and science, and all decisions include business and science. If you're business heavy or science heavy, that's bad. And last but not least, all three of us, Guru, Naveen, and I, we don't care about things that most people care about. Most people care about how much money am I going to get paid? When are we going to go public so I can get rich? All
Hmm.
those things are very distracting and lead to a basically increased risk of failing your company.
Hmm.
Also, bickering and disagreements among the company employees and company leadership in terms of what decisions are going to be made so that they benefit me. Whereas us three, we are truly dedicated to the mission of Viome. Every decision is made for the mission of Viome. It has nothing to do with me or Naveen or Guru. It is the mission of Viome. And so when you have robust science, when you have robust business, when you have leaders who are 100% committed to the mission of Viome, then we are now in our 8th year. We're working towards being profitable, and we cannot fail. Like when investors ask us, what are your failure modes? And I tell them, we cannot fail. We don't have failure modes. They at first laugh and they say, well, that's
Hmm.
stupid, right? Like everyone can fail. And I say, no, we cannot fail. And let me
Hmm.
explain to you why. And I lay it out, and they're like, oh, okay. Where do I put my money? So we raised $175 million because we truly don't have a failure mode, because most companies, most, not all, but most companies in biotech space, they have one product. They will spend several years developing it. Then, if they survive by then, which most don't, they will spend several years or some time marketing it. If it works like a drug, they're going to become huge, right? They're going to get
Sure.
acquired by a big pharma. They're going to make their investors a lot of money. But that's like 1 to 5% of companies do that. The other 95 to 99% fail along the way because they have a single binary success or failure.
Yeah.
We don't work that way. We're building a healthier future. We will succeed. And like I said, nature has already figured all this out. So we're not trying to create a drug that's artificial, that doesn't exist, that may or may not work, and may or may not have side effects, and may or may not kill people. We're not trying to do that. We're simply trying to bring natural way of health to everyone. That already
Hmm.
exists. Everyone wants it. We're not doing something crazy like that. So those are some main reasons why we cannot fail. How
Yep.
cool is that?
Yeah, that's amazing. Yeah, absolutely. The team you guys have in the Viome is amazing. Navin is one of my inspiration, and he's a very motivational guy. And I'm learning more about you. It looks like you have a lot of energy and time involvement, almost 14 years, and it's a dedication to something I really appreciate that you're doing, the changing the humanity in terms of changing people's life and being a
Yeah,
doctor. For
let's
me, yeah,
I just want to mention, I just want to make sure the audience doesn't think that I'm some kind of a workaholic and I just, like I've thrown my life at work,
yeah.
right? Like I said, I have combined work, family, and fun all into one. And
Yep.
let me just give you some stats. My son is now 20 years old.
Hmm.
We have taken him to 65 countries. And
Wow.
from the time he was born until he graduated from high school, so the first 18 years of his life, he was traveling on average 2.5 months per year. On average.
Really? Wow.
Yes. And that's how we visited 65 countries with him, right? We
Wow.
we went through, for example, when we tell the school in elementary school, we need to take him out for a month. They said you can't
Hmm.
do that. And I said, well, what do you mean you can't? They're like, well, you can't. If you do that, the police will come to your door and like ask you, what are you doing to this person, to this kid, right?
Yeah.
So we had to invent a mechanism basically where we disenroll him from school officially. He's like out
Hmm.
of school. And that way he comes off that list of police looking for you. And then we re-enroll him a month later. And then we go on vacation a month later. I mean, we go for a vacation for a month during school. And during that month, he's still doing homework and he is gathering all these memories from places we've been. And then when he comes back, he gives a presentation to the students, to his peers, about what countries he visited, how is the life there. He shows them pictures. He explains how they get food, how they do agriculture, how they live, all that stuff.
Yeah.
So after we did
Absolutely.
that for a couple of years, the principal of the school would be like, so where are you guys going this year? Now let's make a poster because his poster last year was great. And so you have to
That's
be
great.
inventive. You have to be inventive. I see so often people want to take their kids on travel and they're discouraged because there's this notion that, oh my God, it's so hard to travel with kids, and it's so hard to fly with kids. And then, oh, the school doesn't want you to take kids out. And, it's going to affect my kid. Believe me, vacation for a kid to a foreign country is far more valuable than anything he can learn in school or she can learn in school in that period of time. Far more
Absolutely.
valuable. And
Absolutely.
so apply the same principles that I've discussed in terms of like mission professionally. Apply the same principles to your family, to your fun, to your vacation, right?
Yep.
And so just do it. Just do it.
Yeah.
Don't care about what others say or what the society thinks. Just do it right. And
Yep. Yeah. I
anything
agree.
goes. Anything
Have you
goes.
been to Nepal, by the way, by any chance?
Man, it's been number one on our list for a long time. We are
Yes.
thinking of going this November. I have a great friend in Kathmandu, and I can't wait.
Okay.
I mean, we've had such
Yeah,
good.
let me know. Let me know if I can be any help. I've been there, lived there for 26 years, and and it'll be amazing. If you go there, let me know.
I'm so looking forward to it. Yeah.
So, Momo, so basically, we covered a lot of things of Viome, but my last question on Viome, since at the time we're almost 30, 40 minutes now, what is the ultimate vision? Like, let's say 5 to 10 years from now, what are you seeing Viome going through?
Well, the vision is that I already told you that 5 to 10 years from now there will be this Viome app that will have Coach Vi that will be basically coaching every person on the planet how to make good decisions for their health.
Okay.
And the part that I missed that's super important is that all of that will be free to the user. And so
Okay.
today, someone can go on our website and say, wow, it costs $100 for a test. How many people can afford that?
Mm-hmm.
Today, it costs money because it's not a proven technology yet. But when we complete randomized control trials to show that this actually works, when we build health economic models to say, if you invest in your health for X years,
Mm-hmm.
you will avoid paying medical bills to the tune of 10 to 100 times more over your lifetime. So when
Mm-hmm.
we prove that preventive medicine truly saves money, then every payer is going to pay for Vio because they're going to pay less for your healthcare, right? And so whether you're a self-insured employer, whether you're a vertically integrated insurance plan,
So,
and most go ahead.
a quick question on the payment. Use the payment is just for the app, or you're talking about the whole service and product for the volume?
Well, no, everything. But the app is just basically the output of the results and recommendations. The
Okay.
core of our technology is measuring the biochemistry. So customers have to provide a stool, blood, and saliva samples. And these are all
Mm-hmm.
collected at home. So it's not phlebotomy blood, it's just finger prick blood. But blood, stool, and saliva, they have to provide that every 6 months. We analyze those in our clinical lab.
Okay.
And then the AI models crunch those data and produce results and recommendations, which are then displayed on the app.
Okay. So
And they're
all three, blood, stool, and saliva, or is just
yes,
blood?
that's that. Well, I
Okay.
mean, that's sort of stool is the minimum. Blood,
Okay.
stool, and saliva are really nice, but
Mm-hmm.
eventually, 5 to 10 years from now, there will be many more tests that we will be performing because remember, the human body is very complex. So there's lots of testing
Wow.
that we need to do.
So this test kit will be sent to the home and people's
Exactly,
home,
exactly. We ship
and
globally to many countries, not all countries yet, but to many
yeah.
countries. And then, yes, the sample collection kits are shipped at home to home. People collect their samples and ship them back to us at room temperature. Nothing special about shipping. And then we analyze the data. And then, based on your biochemistry, yours, not
Mm-hmm.
average human, not some other people, yours, we actually make very precise nutritional recommendations.
Okay.
And so imagine a healthcare system like the UK's NHS, National Healthcare System, right? They're spending so much money just to try to manage the illness, and they still cannot do that. So that their healthcare system is breaking the economy of the whole country because they're
Mm-hmm.
spending too much money, yet they're unable to serve their population in timely and effective manner because they're always behind the progression of disease. And
Mm-hmm.
so they and Australia and Canada and the US and all other developed countries and developing countries are coming up to that level. They're going to have to refocus on preventive medicine. And so
Mm-hmm.
when we prove that this is truly preventive medicine, the payer is going to be paying for all these services, the tests, the AI algorithms, the app use, the supplements, all of that, because
Sure.
that'll be money well spent. It'll be much lower healthcare
Yeah.
costs to keep people healthy instead of manage their illness for the rest of their lives.
Sure. So I was just curious since you mentioned about this test and it sounds like amazing stool blood and thing. Because I'm a doctor. I do practice medicine in this country for more than 15 years now. So do you guys have any modalities or in the future to partner with the medical team, like, so that they can order a test for the patient? Because I think
So,
uh, I just was curious about that
yeah.
because I
So
was
all of our tests can be ordered by a person, except we have one cancer detection test that has to be ordered by a provider.
okay.
Um, so Any doctor in the United States can simply tell their patient, "Hey, go ahead and order the Viome test, and when you get the results, let's discuss what the results say, and let me maybe connect you with a nutritionist or a coach to actually, you know, help you interpret the results and help you succeed, help you implement those results." Right? So any doctor can do that. That's already available. Um, but there's a fundamental problem with that, in that doctors need to make money for their hospital, and recommending them to go to Viome, if the person is depressed and their depression goes away after they switch to their nutrition, or if a person has IBD and their IBD goes away, then the hospital doesn't benefit from that. So there's a fundamental conflict of interest here, right? If nutrition can solve the problem, then they won't need medical services.
Hmm.
So that's one big problem. The second big problem is that doctors do not benefit financially from ordering our test. When you
Hmm.
order a test otherwise, you probably benefit financially from either that or recommending drugs that are based on that test. But Viome's tests and Viome's recommendations, everything that Viome recommends, you can go pick up at Whole Foods or Trader Joe's. And so there is no benefit to the medical system. So there has not been really traction in the medical system as a whole, although we do have lots of functional medicine doctors and lots of mainstream doctors that are encouraging their patients to go and get their nutritional recommendations, because they believe that they're going to help the patient. And that can be also combined with the modern medicine in terms of pharmaceuticals, right? So you can combine nutrition with medical treatments. And so we do have traction. It's just not a system wide, because Viome doesn't benefit the medical system and the insurance companies. So,
Yeah, yeah. I mean, I guess I am also, trying to figure out the journey in my life. Came to this country like yourself with nothing, and now I'm to the point now chasing my passion and my dream, and this is the reason I'm talking to you today, finally, and hopefully there is some collaboration here. The listeners who are going to be listening to this will be mostly doctors who's trying to practice regular medicine, but the future of medicine, it's more than focusing just on symptoms, or finding the root cause of problem, which is our food, which I believe is food is medicine, and personalized nutrition, which you mentioned before, based on data, it's going to be game changer. That's the reason I want to interview you, and hopefully we can interview Naveen in the future just to see his perspective and really like what he says. But in the time, because we don't have a lot of time now to ask you, I have two more questions and they'll be all done. One second last question is, how do you define success, and what is the biggest win in your life?
I mean, to me, success in the short term is that our randomized control trials work. The moment that we can show that our randomized control trials work, that is the gold standard for proving that something actually reduces disease burden. And so we are running those right now. We have very solid preliminary data. In fact, we're about to publish a paper on some preliminary data. We published already a paper last fall showing the efficacy is very good for depression, anxiety, IBS, and type 2 diabetes, but those were not randomized controlled trials. So doubters
Okay.
can say, well, this could be a placebo effect, and that's true, but the efficacy was very good. So we published that in the American Journal of Lifestyle Medicine.
Okay.
So the short term success is basically randomized control trials working. Once that's over, then I know that this whole platform is going to be successful.
Okay.
And the next level of success will be widespread adoption by healthcare systems. So the moment that a healthcare system in a country says, we are going to pay for Viome for every citizen of this country from birth to death, to me, that's a real big sort of approval of the whole concept that nutrition is in fact important for health and preventing
Absolutely.
diseases. And so those are sort of big milestones coming up, and we're working towards those.
That's great. And what is the biggest win in your life so far?
Well, that's a more like a philosophical question, but I would say the biggest win was leaving Yugoslavia. You can't. I mean, if I had stayed in Yugoslavia, none of this would have happened. It's basically that's unfortunately what it is. So.
Sure. So thank you so much. I guess we're towards the end of the show. I would like to, this last question, where people can reach you, and what is the last word you want to say before you leave?
Well, I mean, I'm on LinkedIn, so people can connect with me on LinkedIn, and I post lots of updates on LinkedIn. And that's it. Just like I said, the main message for me to anyone is stop discussing other people, stop talking about problems, go decide what problem you want to solve, however small or big it is, and starting today, go and solve it. Don't talk about it, just solve it. Work
Sounds
on it.
good. That's
Yep.
really, really inspiring, and really appreciate, honor to have you in the podcast. Everyone listening today, watching today, please go ahead and subscribe to the channel, and hopefully looking forward to have another show down in the road. But I really appreciate your time, and thank you so much.
Thank you for listening to today's episode of Dream Big and Think Different. We hope you enjoyed it. Please be sure to subscribe to our show so you don't miss any gold nuggets. And we'd appreciate it if you could rate and leave us a review on iTunes, Spotify, and other platforms. Until next time.